the Apollo brand. We are a daycare surgical center, but we take immense pride that what Dr. Sampath has done in our center. Such a, I wouldn't call him complex, but such a noble thing, I would say, because you'll hear as he and his team speaks that we had been a part where we've been able to give hearing and probably speech also to a child who was born deaf.
So we have a fantastic team here at Apollo Spectra doing some of the finest state-of-the-art surgeries comparable with anywhere in the world. I was trained for close to 6.5 years in institutions abroad, primarily in Europe, and I worked with some of the legends in skull-based surgery. So Europe alli ಕಡಿಮೆ ಪಕ್ಷ 6.5 ವರ್ಷ ಅಲ್ಲಿ ಟ್ರೈನಿಂಗ್ ಪಡೆದು ಸ್ಕಲ್ ಬೇಸ್ ಸರ್ಜರಿಗಳಲ್ಲಿ ಕಾಕ್ಲಿಯರ್ ಇಂಪ್ಲಾಂಟ್ ಸರ್ಜರಿಗಳಲ್ಲಿ ಉನ್ನತ ಮಟ್ಟದ ಟ್ರೈನಿಂಗ್ ಪಡ್ಕೊಂಡು ನಾನು ಇಲ್ಲಿ ಬಂದು ಅಪೋಲೋ ಸ್ಪೆಕ್ಟ್ರಾ ಹಾಸ್ಪಿಟಲ್ ಜೊತೆ ಸೇರಿ ಇಲ್ಲಿ ನಾವು ಆ ಯೂನಿಟ್ಗಳನ್ನು ಸ್ಥಾಪನೆ ಮಾಡಿ ಇಲ್ಲಿರುವಂತಹ ಫೆಸಿಲಿಟೀಸ್ಗಳನ್ನು ಅಪ್ಗ್ರೇಡ್ ಮಾಡಿಕೊಂಡು ವಿ ಹ್ಯಾವ್ ಬಿನ್ ಏಬಲ್ ಟು ಸೆಟ್ ಅಪ್ ಅ ಸ್ಟೇಟ್ ಆಫ್ ದ ಆರ್ಟ್ ಇನ್ಫ್ರಾಸ್ಟ್ರಕ್ಚರ್ ಕಾಕ್ಲಿಯರ್ ಇಂಪ್ಲಾಂಟ್ ಮತ್ತು ಸ್ಕಲ್ ಬೇಸ್ ಸರ್ಜರಿ ಮಾಡೋದಕ್ಕೆ ಬೇಕಾಗಿದ್ದಂಥ ಎಲ್ಲ ಸಪೋರ್ಟನ್ನು ನಮ್ಮ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಅವರು ನಮಗೆ ಕೊಟ್ಟಿದ್ದಾರೆ. ನಮ್ಮ ಟೀಮು ಚೆನ್ನಾಗಿ ಪರ್ಟಿಕ್ಯುಲರ್ ಕೇಸ್ ವಿಷಯ ಮಾತಾಡೋದಾದ್ರೆ ಈ ಮಗುವಿಗೆ ಹುಟ್ಟಿನಿಂದಲೇ ಶ್ರವಣದೋಷ ಇದ್ದಿದ್ದು ಗೊತ್ತಾಗಿರೋದು ಈ ಮಗು 2 ವರ್ಷ ವಯಸ್ಸಿನಲ್ಲಿರುವಾಗ. ಸೊ ದಿಸ್ ಚೈಲ್ಡ್ ವಾಸ್ ಡಯಾಗ್ನೋಸ್ಡ್ ಟು ಬಿ ಹಿಯರಿಂಗ್ ಇಂಪೇರ್ಡ್ ಆರ್ ಡೆಫ್ ಆರ್ ಪ್ರೊಫೌಂಡ್ಲಿ ಡೆಫ್. ಅಂದರೆ ಒಂಚೂರು ಕಿವಿ ಕೇಳೋದಿಲ್ಲ. 10%, 20%, 30% ಕಿವಿ ಕೇಳದೇ ಇರೋದು ಎಷ್ಟೋ ಜನರಿಗಿದೆ. ಇನ್ಫ್ಯಾಕ್ಟ್ ಭಾರತದಲ್ಲಿ 6 ಕೋಟಿಗಿಂತಲೂ ಜಾಸ್ತಿ ಜನರು ಬಹುತೇಕ ಮಾಡರೇಟ್ ಟು ಸಿವಿಯರ್ ಹಿಯರಿಂಗ್ ಲಾಸ್ ಅಂತೀವಿ ನಾವು. ಅಂದರೆ 50% ಜಾಸ್ತಿ ಹಿಯರಿಂಗ್ ಇಂಪೇರ್ಮೆಂಟ್ ಇರೋ ಕಮ್ಯುನಿಟಿ ನೋಡೋಕೆ ಹೋದರೆ ಭಾರತದಲ್ಲಿ 6 ಕೋಟಿಗಿಂತಲೂ ಜಾಸ್ತಿ ಜನರಿದ್ದಾರೆ. ದರ್ ಆರ್ ಮೋರ್ ದೆನ್ 6 crore ಪೀಪಲ್ with hearing impairment, and we're talking about moderate to profound hearing loss who require some form of treatment, support and guidance. So ಇದರಲ್ಲಿ ಈ ಮಗುವಿಗೆ ಶ್ರವಣದೋಷ ಇತ್ತು ಅಂತ ಗೊತ್ತಾಗಿರೋದು 2 ವರ್ಷದ 2 years of age. This child was diagnosed to be deaf, and this patient came to us and we confirmed the diagnosis and we advised the family the only option that we had, that is to do a surgery and put a implant. An implant is different from hearing aid. So ಈ ಮಗು ನಮ್ಮ ಹತ್ರ ಬಂದಾಗ ಈ ಮಗು ಕಿವುಡುತನ ಇದೆ ಅಂತ ಡಯಾಗ್ನೋಸ್ ಮಾಡಿಬಿಟ್ಟು ಆ ಕಿವುಡುತನವನ್ನು ಸರಿ ಮಾಡೋಕ್ಕೆ ನಾವು ಸರ್ಜರಿ ಮೂಲಕ ಒಂದು ಇಂಪ್ಲಾಂಟ್ ಅನ್ನುವ ಡಿವೈಸನ್ನು ಕಿವಿ ಒಳಗಡೆ ಹಾಕಿ ಅದನ್ನು ಸರ್ಜರಿ ಮೂಲಕ ಹಾಕಿ ಆ ಮಗುವಿಗೆ ಕಿವಿ ಕೇಳಿಸುವಂತೆ ಮಾಡಬೇಕು ಅಂತ ಹೇಳಿ we recommended this. Dr. Sampath Chandra Prasad Rao. I am a cochlear implant surgeon and a skull-based surgeon working here at Apollo Spectra Hospital. So this particular child that came to us was a 2-year-old child which was diagnosed to be deaf bilaterally, that is in both the ears. And this is what we call sensory neural deafness that is originated in the inner ear at the area of the origin of the nerves of the inner ear. So when the parents approached us saying that the child was not responding to voice, to sounds, and the child was also beginning to have delayed speech development, we then tested the child and we diagnosed that the child had what is called bilateral profound sensory neural hearing loss. So multiple tests were conducted, scans were taken to make sure that the anatomy of the cochlea and the nerves coming from the cochlea were all right. So the only solution that is available for this kind of bilateral or both side deafness is cochlear implantation. Now, what is cochlear implantation? This is a very, very unique surgery using a very unique device called a cochlear implant. And the word cochlea comes from the 2.5 turn structure, a snail-like structure that is there in the inner ear called cochlea. Hence, cochlear implantation. Now, this is a device which has 2 parts. One part goes behind the ear under the skin, it is implanted, and the electrode goes into the inner ear inside the cochlea. It is in the shape, the electrodes take the shape of the cochlea. Then the skin is closed, and then the outer component comes in, and the outer component is called a processor, which picks up sound and transmits the sound into the inner component. It's a very complex device developed a few decades ago, but now it's reached the pinnacle, and we are having some excellent devices which produce very, very good quality sound. Now, when this parent came to us, when we diagnosed this condition, I recommended that the best solution would be to bring back hearing not only in one ear but in both the ears. We call this bilateral cochlear implantation. Now, when this was offered to the patient party, they were very happy, and they wanted to go ahead. They were very motivated family, and when I offered them the range of implants, ranging from cheaper implants to more expensive implants, they were motivated enough to go for the best quality implants in both the ears. So we put in what is called Cochlear CI632 implant with the processor called Kanso 2 processor, coming from a company also which is called Cochlear. So this was decided upon, and we did a bilateral cochlear implantation in a 2-year child, where one implant was put for each ear. Surgery went on very well. We intraoperatively monitored all the electrodes, and we found that the implant had gone in successfully, and after which the child is recovering very well. Thank you.